scalpel. It was a late afternoon when Halsted injected a little bit of cocaine into his arm. What had started as a fascination with this new anesthetic became a lifelong addiction for the prominent surgeon. In the 19th century, it was common for physicians to use themselves as a guinea pig for their treatments. In another part of the world, Freud was experimenting with cocaine as well. William Halsted had numerous contributions to the development of surgery as we know it today. This proved both his dedication and love for the field. He suspected that cancerous cells spread through blood or lymphatic vessels, nowadays called hematogenous or lymphatic spread. As a consequence, he advocated and implemented radical mastectomies as a treatment for breast cancer. This treatment consists of completely removing the breast to prevent any cancer to spread throughout the body. Halsted also pioneered the first blood transfusion. He thoroughly reinforced the use of gloves in the OR, an asepsis method standardized nowadays in every OR. Halsted's life is split into two eras. During his New York period, he was described as a bold socialite with fast reflexes in surgery. His surgical training during this period followed a 2-year trip in Europe, where Halsted had the opportunity to see how German physicians trained. In his New York years, namely in 1884, he started to experiment with cocaine. This substance was enthralling, since it gave him the ability to become a high-functioning surgeon. Apparent that his newfounded addiction was preventing him from performing. He had to leave the patient on the operating table, as his shaky hands were not suited for the surgical gesture. Baltimore period paints Halsted as a recluse, having prolonged periods of absences from his practice. It is during this period that he builds the standard model for surgical residency, used even nowadays in the US. His ongoing addiction was masked by his change of attitude towards surgery. Instead of encouraging his previous fast surgical technique, he emphasizes a more accurate and deliberate approach. However, he enters less and less in the OR due to the effects of cocaine. Halsted founded the surgical training programs as we know them today. The 70 to 100 hours per week mentality was found then. Halsted reportedly encouraging his residents to work 362 days per year. Halsted advocated for a pyramidal structure with multiple tiers for residents. As famous physicians were trained in this program, they went on recreating the same structure in the newer founded surgical training programs. However, returned from World War I, found that the neurosurgical chair he was promised during his training by Halsted had been given to Walter Dandy. Appalled by Halsted's decision, he went on founding the Connecticut Surgical Program. In 1932, he founded the Surgical Residency for New York Hospital and Cornell. Daryl Hart, another acolyte of Halsted, went on to create the Surgical Residency at Duke's University. Even one of his early students, Harvey Cushing, transferred to Brigham and Women's Hospital and became Surgeon-in-Chief in 1912.